Hi everybody, my name's Dr. Jo. I'm a psychiatrist in Christchurch, New Zealand. Just talking about the treatment of sleep difficulties. In my other video I talked about some of the reasons why sleep was really important at the moment, and also some of the self-help strategies that you can use to try and improve your sleep. But sometimes sleep problems continue on longer term, or self-help strategies aren't enough. What's been shown to be most useful, particularly for longer term sleep difficulties, is something called cognitive behavioural therapy, which is normally something that you go and see a psychologist for. CBT-I, which is I for insomnia, has been shown to be the most useful strategy for helping difficulty with sleeping longer term. Sometimes medications are useful as well. The medications that tend to be most useful for difficulty sleeping are called benzodiazepines. An example is temazepam, or benzodiazepine-like medications like zopiclone. These medications work extremely well in the short term to help people with sleep. The problem is that over time, sometimes even by the second week, they become less effective as our body gets used to them. And so one of the things you can do is to have nights when you don't take the medication so that your body doesn't develop tolerance to it. These medications are also best taken shorter term rather than as a long-term solution. For some people, difficulty sleeping is more complicated, and it's not just a short-term response to stress. So it's important to talk with your doctor about whether you may have symptoms of depression that are causing your difficulty sleeping. There's quite a few antidepressant medications that can be helpful for sleep, and your GP can talk through those with you. Some of the medications that can be particularly useful are tricyclic antidepressants and mirtazapine because they're sedating when you take them at night. Some people also have difficulties with PTSD, and there are some medications like prazosin or clonidine which can be particularly helpful if people's sleep is broken with nightmares and other PTSD symptoms. And for other people, it's pain that's keeping them awake, and there are some options you can talk to your doctor about, like pregabalin and gabapentin, which can help both pain and sleep. You may also have heard of a medication called melatonin. The research suggests that this is particularly useful for people over 55 who have difficulty sleeping. And melatonin is a chemical that's naturally in our body that tells us when we're ready for sleep. So there are quite a few options, and if you're really struggling with sleep and the self-help strategies aren't helping, then it's important to talk to your doctor about sleep, because as we know, sleep is incredibly important for both our physical and our mental health. So we'll talk to you soon. Take care.